You should all be seeing that pop up for the live stream. You are live.
Welcome and thank you everyone for joining us today for Mental Health and Franklin County Resources. Franklin County Department of Job and Family Services, Lunch and Learn. My name is Joy Bivens. I am the Deputy County Administrator of Health and Human Services under the Board of Commissioners, and I am excited to host and facilitate this Lunch and Learn today on behalf of our Franklin County Commissioners, Commissioner Kevin Boyce, Commissioner Erika Crawley, and Commissioner John O'Grady. Before we begin our conversation today, I'd like to give you a little bit of background just so you'll know why this discussion is so important for the mental health and well-being of every resident in Franklin County. Then we'll move right into questions to our panelists. The COVID-19 pandemic is having a major impact on mental health. A Center for Disease Service Control report found that in June 2020, anxiety disorders, depressive disorders, substance abuse, and suicidal thoughts were all on the rise. For example, from June 19th to June 20th, it was 3 times many people reported to have anxiety disorders, 4 times many people reported depressive disorders, and 1 in 10 people started or increased substance abuse. Suicide, with twice as many people seriously considering suicide in June 2020 as compared to the entire year of 2018. So what is Franklin County doing to address the increasing mental health crisis impacting our residents? Well, studies have also shown that as many as 75% of people feel more comfortable taking a self-paced approach in addressing their mental health issues. The stigma associated with mental health illness likely plays a role in this, but we recognize that we are in the midst of a mental health and behavioral crisis as well. We have seen more than ever before. We need to meet people where they are, and that's where the Credible Minds platform comes in. Our Franklin County Commissioners have funded the Credible Minds technology platform to connect families with nationally and local resources to address their mental health and emotional crisis. We understand in Franklin County as leaders, many times crises do not have business hours. It happens after 5 o'clock or on the weekends when most entities and businesses have closed. The new website, www.franklincounty.ohio.crediblemine.com, allows Franklin County families to research information and resources on over 200 emotional mental health topics. Visitors can take a self-paced assessment and be connected with apps, podcasts, videos, articles, books, and many more, all on this evidence-based platform that are known to help a variety of mental health and well-being topics. It also provides us with access to an array of analytic data to track different trends, platform utilization while protecting all personal information. This platform can be utilized from anyone from 0 to 99 because we wanted to make sure that this platform was accessible to the multi-generational household. The Board of Commissioners addressing mental health through the franklincounty.ohio.crediblemine.com website also supports goal number 9, and as many of us know, in our Rise Together blueprint, reducing overall incidence in racial disparities and occurrence of preventable diseases and trauma. So joining us today, which I'm very excited, we have some very awesome people with us today. Erika Clark-Jones, CEO of the ADAMH, Robbie Graham of Lost Community Services. We want to provide you with the information about mental health, suicide prevention, and various other resources through ADAMH and Lost Community Services and the county's mental health website. Thank you all for participating in our conversation today so our community members can become more familiar with the wonderful services and supportive services that you all provide on this very essential topic as relates to mental health. We also have Andrew Krismer from Franklin County Department of Job and Family Services, who is going to walk us through the Franklin County website to provide us with an overview of the new resource for our residents. Thank you for joining us, Andrew. Please walk us through the website for the franklincounty.crediblemine.com. And Andrew, you should be able to share your screen. And you can do a very brief overview because we really want to make sure that we're able to get to our panelists and hear the wonderful resources and supportive resources and all the wonderful things that our residents have access to here in Franklin County.
Thank you, Deputy County Administrator Bivens. I'm going to very briefly just go through the basics of the platform. Let me condense there we go. So as you can see, franklincountyohio.crediblemine.com, and we'll make sure that everybody has that. At the top here, you see that there are topics, assessments, news, community resources, COVID-19 resources, and then in crisis. And so we have a variety of different topics, tools, and then also different resources. So if you are a visual learner, there are TED Talks and videos. If you are an auditory, you can listen to podcasts. If you like to read, there are articles ranging from 500 to 3,000 words. And then every topic here that you are going through, if your family is going through, from well-being at work to overall mental health, such as anxiety, stress, depression, or addiction. So there's a wide variety. If you scroll down, you will see, you scroll down, you'll see a variety of resources down here, and you can get a sense on what's on offer. And then I think the real resource, the real tool that we offer people here are the profiles. And so the main profile here, and you can click around and do different profiles, everything from work to family life. But the main profile takes about 12 minutes. So I'm going to go ahead and click on it here. And it asks you a list of questions about your life and about your situations, such as, are you enjoying your life? You consider yourself happy or less happy. It's going to take you through several iterations of this, several pages. And then along the side, if you want to do further research, or if you want to just look into a scientific citation, everything is cited here. So this is evidence-based, it is anonymous, and it is data-driven. And so, well, it won't let me go through, but I'll just very briefly show you what, it's going to take you through a bunch of these. You click on them, and then by the end, it is going to take you to what's called the mental health profile. It's going to give you a summary of the areas you're doing well, areas of concern, and then a list of community resources at each turn that is going to, that will guide you towards the resources that we have available either nationally or within our own community here. And so this is basically the resource in a nutshell. And I will turn it over to our friends at ADAMH to get on with it.
I have it, Andrew.
Oh,
yep.
I will turn it back over to DCA Bivens.
Yep, I got it. So we are excited. I hope we will post that website and that portal for everyone to have access to. And thank you, Andrew, for the overview of the Credible Minds. And again, welcome Erika Clark-Jones and Robbie again, and invite them to introduce themselves and take a bit to talk about their roles. Director Erika Clark-Jones, can you talk a little bit about what your role and what your agency does?
Yes, absolutely. Well, first and foremost, Deputy County Administrator Bivens, it's a pleasure to be here with you today. And I'm honored to also be on this digital panel with Robbie Graham from LOS. I serve as the Chief Executive Officer of the Franklin County ADAMH Board, and that is Alcohol, Drug, and Mental Health Board. Here in Franklin County, we're the largest ADAMH board in Ohio, but we have 49 other boards as colleagues across the state of Ohio, all working every day to make sure we secure a behavioral health safety net across the community.
Mr. Robbie Graham from LOS.
Yes, thank you so much. I am very honored to be here and be a part of this conversation. My name is Robbie Graham, and I am with Lost Community Services. We are based here in Franklin County, and we serve those who have lost someone to suicide. LOST stands for Local Outreach to Suicide Survivors, and we do what's called Postvention. We come in, we have teams that are activated by the coroner's office who actually go when someone has died by suicide, and we engage immediately with them, bringing resources for those who are left behind so that they can get the help they need. We do this because there's so many people. There's been research done where it was up to 5 years before people were getting the help they needed because they would stumble around. We called it the stumble factor, trying to find what they needed. We wanted to be able to cut that down, and so we used the model of a LOST team to be able to cut that down. And we also provide other services beyond just the event itself, but also ongoing for several years now. We stay with them and we're a part of the journey. So thank you again for letting me be a part of this.
Absolutely. And thank you both. I'm going to pose a question to both of you, and I'm going to start with Director Erika Clark-Jones. The question is first this: what aspects and categories of mental health do you see residents experiencing, particularly in Franklin County?
Yes. Well, thank you for the question. And even before I answer this question, I have to just commend you for your leadership, not only, over this last year when everyone is relying on each other, right, to get through this pandemic, but for your leadership for so many years. You've been consistent and a vocal and consistent advocate for the people of Franklin County. And I think that matters when we're setting policy agendas and for hosting forums like these and asking the questions that people want to know about. So thank you for your leadership. It's continuous, and our county's better off because of that, DCA Bivens. From the ADAMH perspective, what an extraordinary time that we are experiencing as a county, as a people, as a community. But everyone, regardless of background or personal circumstance, is dealing with significant levels of stress, anxiety, of loss, uncertainty, because of health and safety concerns for themselves and for family members. And due to the pandemic, people are experiencing loss at many levels, right? We're talking about deaths of family members, job loss, financial insecurity, food insecurity, housing insecurity, the list goes on. And this includes some people who are not necessarily used to this type of loss and the grief that comes with this type of community loss. So we're seeing that across the board. Robert, Robbie, you might have a different perspective.
No, I think what you said is perfectly straight on. It's this combination of things that we see can contribute to the, I guess what you'd say, the faltering of people's mental health. And especially during the pandemic, there have been people have been, in a sense, cut off from service, or at least feeling like they're cut off from services. I know there were many services that were still available, but because in communication or whatever the case may be, they felt like they were cut off. They didn't know how to access it other than a particular way. And so I think that has led to an increase in people's feeling of stress, especially in their lives.
Director, I'm going to ask you, many times when we think of ADAMH, we particularly in government, we say ADAMH, and it's just those of us who know what you do or what your agency provides, we assume everyone else does. Would you please inform the residents of Franklin County, what exactly is ADAMH? First of all, what does that even mean? Yep. And then how does that benefit me as a resident? What do you do?
Absolutely. I love that question. It's like, I love bringing, we are your ADAMH, first of all. And ADAMH, it's an acronym, and it does stand for the Alcohol, Drug, and Mental Health Board of Franklin County. So those are the things that we care about, but we care about it on behalf of our county's residents. So the roughly 1.3 million people that live here in Central Ohio. So what we do is we support the behavioral health safety net in Franklin County. So our job is to plan, the network and work with all of our provider agencies. Our job is to fund the community behavioral health safety net, and it's to evaluate how well we're doing and how well we're meeting the need. So we do this through a network of over 33 providers. And Robbie in the LOS program is a part of the LOS organization, is a part of our provider network. And quite frankly, I call our provider network the real heroes, right? They are the people on the front lines, 24 hours a day, 7 days a week, taking your calls, seeing patients in the parking lot, as Robbie mentioned, seeing them over telehealth, seeing them in person at facilities, at your home, responding to psychiatric emergencies. They're in the emergency room to assist our docs on hand when there are psychiatric episodes. So these are our real heroes in our community, and I give every single one of them 2 gold stars if I could. But these 33 providers offer services that cover the entire continuum of mental health. So what does that mean? That means first, prevention. We want early detection of mental illness among our youth and adolescent population to make sure we get in front of some of these challenges. And we partner, for example, with Nationwide Children's Hospital Behavioral Health Pavilion to make sure those services are delivered on time to family members, and really, quite frankly, educate family members on how to support their loved one with a mental illness. We also work in schools to do prevention work. We also address crisis. Some of our biggest crisis providers, NetCare, Access, there on the west side, is a crisis provider, as well as Mary Haven is a crisis provider, and among others. We offer treatment, those with substance use disorder, as well as mental illness. For folks that need treatment and access to treatment across the community, we support those providers that offer treatment. We offer housing for those with serious and persistent mental illness across our community and various properties for those people who are too ill to be able to live alone. And then we offer recovery supports for those coming back from a substance use disorder or addiction, or living with addiction, and helping them to stay in recovery and get well for the long run, not only for themselves, but for their family members. And then family supports. You know, our local NAMI is awesome. They are a fantastic group of advocates and parents and friends, and they really, at the end of the day, when family members are struggling, mothers and fathers and siblings and kids not understanding their parents' mental illness, who can they turn to say, hey, I've been on this journey with you. This is what's worked for me, and I'm standing here with you. So we support the work that they do as well.
So I'm going to ask a follow-up question. Many times when services, you all have a variety of services, a plethora of services, and I'm thankful that you outlined them for our residents. Many times for these services, and I'm going to speak from the hat of a resident, in accessing these services, there's the qualifiers. Mm-hmm. So in order to qualify for your services, what do I have to qualify? Is there an income guideline? Is there a age cap? Is there a, what do I need to do in order to be eligible for the services that you offer at ADAMH?
Sure. I think that's a fantastic question. And I'm gonna take the long road to answer this. But in short, let me say, ADAMH never wants anyone to be turned away because of their form of payment or their lack of resources. So that's first and foremost. And all of our residents have different levels of insurance coverage, but ADAMH is here in the event that you don't have coverage, that we stand in the gap for that. Now, I will say this. We recently did a community needs assessment, and one of the big things that came out of that was access. How do people access our services? When they show up, what kind of form of payment do they need? And so ADAMH makes sure that everyone in Franklin County has access to equitable, quality mental health and addiction services. So that's first and foremost, hands down. We provide resources to those who are uninsured and in need of services not covered by Medicaid, such as housing, transportation, crisis services, and more. We also provide services that benefit the entire community, such as crisis, for example, at NetCare Access, early intervention and prevention. So through our network, you should know that at any ADAMH network, support services on a sliding fee schedule. Okay, or a sliding fee scale. And that means a sliding scale for services means any Franklin County resident can receive needed services and be charged on the basis of income and circumstance. And again, when there is a gap, ADAMH fills it in.
Thank you, Director. We're going to come back to you because we're going to make sure that our residents know how and where to access, where that intersection starts and stops that, of course. I'm going to go to you, Robbie. September was National Suicide Prevention Month. I believe it was September 5th through the 11th, and Suicide Prevention Week was September 5th through 11th, probably. So, Robbie, you have increased discussions on mental health lately. Many people are not aware of direct correlation between mental health challenges and residents who die due to suicide as it relates to the pandemic. So my question to you is this: how has the pandemic impacted residents? How do you believe the cause of the pandemic has impacted residents who have died by suicide in their families?
Well, probably the biggest way it affected them was they had to postpone memorials and funerals. And that can have a debilitating effect really on their grief and how they're addressing their grief. Because, you know, the funerals aren't necessarily for the person who died, they're for us as we begin our journey of grief. And so being able to access that time of being with others and remembering the person who died, as well as sharing in each other's grief as a support system, can have a very detrimental effect when you can't do that. And so I think that was the biggest way the pandemic affected people who had lost someone to suicide. I know when you, as you began, you cited the facts about, in your opening comments, about the 3 times as many people had anxiety disorders, 4 times as many depressive disorders, and twice as many people considered suicide. And what we saw was an uptick really in the like calls to the hotline, the suicide hotline. But this was actually can be construed as a good thing, even though the media kind of put it out there as like, oh my God, what's happening? It really was a good thing because this was a help-seeking behavior that they were demonstrating. And the reason we know that more people were suffering from these things is because they were reporting it, because they were reaching out and seeking help for what they were experiencing. And though we saw this uptick in the calls to the suicide hotline, we actually overall saw a decrease in suicides. And I think it is attributable to that increase in the help-seeking behaviors.
So while you're on along those lines, Robbie, and thank you for answering that, what services, if I was a resident, what services do you provide to assist me?
Well, we provide a number of different services. One, we do have what we call our response teams, our first responders, who are volunteers who are trained. They're activated by the coroner's office and actually show up when someone dies by suicide and immediately brings support, whether it's a bottle of water, whether it's Kleenexes, just a listening ear, a shoulder to cry on. We also provide a packet that we tell people at that time, you may not be ready to look at this right now, but you will be. And this has some resources that will be helpful for you. So we begin pointing them into the different resources that we have available in the community. We do long-term support we have support groups that are specifically for people who have lost someone to suicide. We do remembrance events. We also have what we call a companion program, where we try to link up appropriately a survivor of a loss with another survivor who has been trained in our companion program, and they are able to meet one-on-one, whether it's for coffee, maybe a dinner, go for a walk, whatever the case may be. If somebody would prefer having that one-on-one relationship instead of a support group, because some people just don't like the support group, the big group kind of intimidates them. And we also do prevention, as we provide what's called QPR training, which is question, persuade, and refer. And it's referred to as a gatekeeper training, where people can learn. We offer them for free throughout the year. People can learn about the different signs and different red flags, if you will, of somebody who is maybe thinking about taking their life and what steps they can take. Even just some simple tools for being able to walk somebody through, get them the help they need. And it helps them feel empowered to be able to do that for somebody else.
You know, since we're talking about, such a very relevant and a very sensitive topic, I don't want to move off of this. I want to kind of dig in just a little bit more. Suicide is one of those things that many people see, it's not like it's a cold. It's not like it is, like a broken arm, and many times some people don't pick up on the signs and symptoms of a person who is having suicidal thoughts. Could you provide with us any references or suggestions or information you have for us to what are things that we should be picking up on in people who are walking around potentially suicidal?
Probably the biggest thing is paying attention to what they're talking about. Are they just talking about wanting to die? I know so many times people, we say different phrases that have become a part of our vernacular, and we'll say things like, oh, I could just kill myself. But you can also pay attention to behavioral changes that they may have. Maybe they're showing signs of depression. Maybe they're drinking more than they usually do, or they're just doing things out of the ordinary for them. Along with what they're talking about, making comments about wanting to die, feeling hopeless, feeling trapped, unbearable pain. These things can all be indicators. And to take the opportunity when you hear those things, ask more questions. Don't just shrug it off as they're just, blowing off steam. They're just doing this. Ask them questions. Man, I feel like I want to die. Why is that? Why do you feel like you want to die? What's going on? Tell me more. I'm feeling hopeless. What's making you feel hopeless? What do you feel hopeless about? Just engaging with them in that conversation. But probably the biggest thing is, what are they talking about? And there are some other cues like the increase in alcohol or drug abuse. Maybe they're acting anxious or agitated. They're behaving recklessly. They're sleeping too little, or they're sleeping too much. And of course, this is going to require us to be a part of their lives, engage with them to be able to recognize that. Maybe they're withdrawing, they're feeling isolated, they're isolating themselves, or maybe there's extreme mood swings. Maybe it's somebody who, maybe they've had a temper, but you're noticing that it's increased now. And especially in men, anger is a big sign of depression in men, and it's coming out what I call sideways, where it's disproportionate. It's something that maybe would normally not upset them to that degree, or something they would never get upset about, and now they are being upset about it. So just these subtle cues in behavior, and sometimes it'd be something that I know for me, I lost my stepson in 2012. Dre was 19 years old, and there were some of these signs that was easy to write off as just teenager. He was a teenage young man acting out. But there are so many things I can look back on now that I see were signs that now, if I see them in someone else, I am definitely taking it more seriously. I'm definitely paying attention to that, because I don't want to miss those things.
So, first of all, thank you, Robbie, for being so transparent. There are a lot of, parents and family members who have experienced this such tragic loss similar to yours. So thank you for being transparent. And also thank you for sharing that information. If you don't mind me asking, what are some preventable, measurements that we as family members and friends and community, what can we do? When you were asking questions, not too long ago, I heard someone say a mom overwhelmed. She had just had a baby, which overwhelm and, postpartum comes with it, right? And she's like, I just don't know if I can do this anymore. I'm going to be here tomorrow, or whatever. And they're like, oh, it's going to get better. And we just kind of walk away, right?
Yeah.
And lets people sit in that. What can we do to be preventive to assist those who struggle with this, so that we can, hopefully mitigate suicide?
Well, like I said, the biggest thing is to listen and to pay attention to what they're saying, to be inquisitive and ask them more questions when they say stuff like that. Being an active listener, and being a safe person for them to talk to, and someone that they feel like holds the space for them. You're not passing judgment on them. You're giving them that space to talk about how they're feeling, and you're not judging them. You're not condemning them. You're not immediately trying to fix them. In the example you gave, and it's a common thing for us to just kind of, it's going to be better. And but if they don't see that it's going to be better, you telling them isn't going to help. You want to help them to be able to see for themselves that it's going to be better. This is also something you can do too, is take advantage of the resources that are out there, like the crisis hotline and the text line. You can access those. Even if you're not the one in crisis, you can still call them. You can still talk to them, ask them questions, say, hey, I've got a friend. And even if they're there with you, I've got a friend here and they're talking about this, and I'm not sure what to say. I'm not sure what I should do right now. They will talk you through it. They will give you the encouragement and the tools you need to be able to help that person. But again, the biggest thing is just being that person who will listen to them. And this is something we also go over in our QPR trainings of how to be an active listener and how to ask questions, how to get more information from them, how to dig a little bit deeper in ways that you can then be able to get them the help they need. And lastly, the biggest thing is not to be afraid of using the word suicide. There's a myth out there that you'll put the idea in their head. Suicide is so inundated in our media and our entertainment, especially, that you're not going to put the idea in their head. And there are studies that have been done that prove this out. You're not going to put the idea in their head. And so many people who have attempted suicide or were on the verge of attempting, where they've been talked to later on as part of this research, they've said that what helped them was just somebody who listened, who gave them the space to be able to get that off their chest, to be able, somebody who listened to them, who didn't judge them, who gave them the opportunity to talk about what was bothering them without it being a try to fix it thing. Just let me talk about how I'm feeling is a huge thing for people who are feeling suicidal.
Director Bivens.
Absolutely. I was just coming to you. Good.
I don't know if you had a question, but first of all, you can see why we so appreciate loss and the mental health professionals that are embedded in our community. This is exactly why having forums like this are so important. You know, Robbie touched on some things that are key. And, you know, I was thinking about us in this conversation today. And in the behavioral health space, in the mental health space, we have a moment. This pandemic has really brought on the need for attention to mental health. I think that's one of the things that has shifted during the pandemic. It's okay, just as your Credible Minds first page says, it's okay not to be okay. All of us have a degree of anxiety, some bit of a depression. We're grieving. So many of us are grieving. Robbie shared that he lost his stepson. I lost 2 relatives. I actually lost my grandmother and my mother in this last year, in part due to the pandemic. And so that grief, and where do you go with it? How do you channel it? How do you use it? Who cares about it? Who can I talk to about it? We all have some form of this. And so mental health is receiving a moment. There was this stigma, and I know that you're so aware of this. The stigma around mental health has existed not only, you know, in America for so long, but then if you bring in communities of color, there's an additional burden and an additional stigma around mental health. Just not sure what to do, writing it off, just saying, oh, you'll be fine, right? And it's okay to not be fine, and then be able to seek help. But importantly, talk to someone about it. Robbie, just as Robbie mentioned, what can we do? We can be a listening ear. The good news is more people are talking about mental health, and there's also more people in the spotlight nationally talking about this. So how do we take this moment and really use that to break down the barriers to having the really important conversations and then connecting the resources? Now, our team at ADAMH is working with your team, Deputy County Administrator, to make sure we give you all resources to post online. And of course, anyone can go to the ADAMH website for suicide prevention, going to Robbie's website at LOS to look at those things that are available in our community for folks to call. The warm line, when their family members just saying, hey, what do I do in this case? Calling our suicide prevention line, our lifeline, to say, okay, I'm seeing this, I'm hearing this, or I feel this way. Reaching out. Robbie, you are so spot on when you said this pandemic caused more people to call, but our suicide rates went down. We want that help-seeking behavior. That's what this is all about. Let's talk about it. Let's talk through it. You're not alone out here. So many of us are going through it together, and you've got a listening ear and a supportive community wanting to see you thrive.
It was like she read my mind, because I was going to talk about the stigma that's attached to it. But I'm going to put you on a spot, Erika, because I think this is one of those conversations for years that have been taboo, particularly in families of color, where it was not okay to say you were okay. And if there was a stigma attached to it, we were saying people were crazy if I told you that, you know, I was experiencing, or if I was in a crisis, right? How do you feel now, particularly for minorities who experience, mental health services since the pandemic, have you feel like we've normalized this conversation or this topic?
I think it can never be socialized enough. Mental health care is healthcare. Just as you go and you check on your heart and your blood pressure, there's a pastor that is always on the internet and says it's okay to have a checkup from the neck up. And at first I was like, I don't know how I feel about that, but you know what? He says it so often that because he wants people to say, all right, it's all right for me to check in with myself, find a therapist, seek a counselor. That's the help-seeking behavior we want to encourage. And these days, when you say, hey, how are you doing? To be able to listen when someone says, I'm not doing so well, right? And then to be able to start that dialogue and say, you know what? I felt the same way too. And how do we help each other through this? And that will propel us to act differently. Whereas before, people were not so forthcoming about how they were feeling, simply because they thought they were in the minority. I think nowadays it shows we all have asked ourselves that question, and we should continue to do that. That's healthy behavior, and to include your mental wellness as a part of your full health care is exactly what we want people to do, of all communities, all backgrounds, whether English is your first language or not, whether you've been a community that's used to engaging mental health professionals or not. This is the time where we say, I'm seeking out those services, and ADAMH wants to make it easier for people to find the support across our community.
You all at ADAMH have been such a strong partner with our Credible Minds platform and releasing that into the community. We really do hope that people utilize that platform. But what I want to ask, particularly of you both, is this. We get up in the morning, we brush our teeth, we comb our hair, we put our clothes on, take our showers or whatever, and then we're out the door. In our household, it's funny, I'm going to share this personal story. I hope my husband's not listening, which I'm sure he is. We get up every morning at 3:30, right? He's up a little bit before 3:30, and he runs 3 miles every day outside, and then we'll go to the gym by 4:15, 4:45. And people are like, well, why do you do that? I'm like, well, it's my mental health time. And I talk about a morning routine. Do you both believe that there should be something incorporated in your day where there is a mental health routine, just like there's a hygiene routine? And if so, give examples of what should that look like?
Robbie, if you want to take your stab at it, then I'll follow you.
Yeah, it's one of those things where I firmly believe in it. I'm not very good at it, but I do believe in it. And sometimes it can be, that behavior can be, even if it's not a specific time. We talk a lot around here in our offices about self-care and taking time for yourself, even if it's just taking a break at some point during the day where, you know what, I'm going to go, I have a particular room in my house or whatever the case may be, where I'm going to go, I'm going to sit. And it's just, that's my time. I got a cup of coffee, a drink, whatever the case may be. And I'm just going to sit, and I'm going to just think about some happy thoughts. It sounds kind of corny, but I like to sit, especially when the weather's nice, be outside on my back patio and just sit and enjoy the sounds of nature and be in that moment. And that's probably the biggest part of it, is being in that moment of just taking the time to, what does my body feel like just sitting here? What does this feel like in my fingers? This mindfulness exercises. Closing your eyes and just listening to the sounds around you, not trying to do anything about them, but just listening. What am I hearing outside? I hear a truck go by. I hear this bird singing. Just taking those times to put yourself into the moment can help so much to quiet ourselves, to free us for a time from the anxieties that are weighing us down, from the anxieties that really drive us. People talk about, I'm driven to do this. And so many times that being driven in a job or whatever really is stemming from an anxiety, a feeling of, I need to pursue this. I have to get this done because it could be tied to a paycheck, or my own self-esteem, my own self-worth is coming from that. I'm getting identity from that. And so therefore I'm being driven, and I'm anxious because if I feel like if I don't do it right, then I'm not going to be what I think I should be. And all this stuff that goes along with it. And just stopping and being in the moment can go so far to help us mentally. And just taking that time each and every day, even if it's just 10, 15 minutes, just stopping and just focusing on your breathing. What does it feel like when I breathe in? What does it feel like when I breathe out? Just those things can help us so much to quiet ourselves down and to go so far in our mental health.
I love what Robbie just shared, and even your routine, Deputy County Administrator Bivens. And I'll share my routine, but then some of the advice, or at least some of the best practices that we've noted during this pandemic. So, first and foremost, everything Robbie said, I completely agree. And self-care is key, whatever that looks like for people. For me, it's the walk. It's the daily walk, whether it's in the morning, it's in the evening, whether it's with my spouse or with my child or with my pet. But it's that time to connect to something bigger than myself, to take us just away from the details that are driving us and allows me to step back. And we do encourage that. And I've seen several journals that say sometimes just stepping outside, stepping into a larger space where your concerns don't just dominate the space, but you're able to take in the trees. You're noticing the wind. You're noticing your own thoughts, your breath, your steps, your neighbors, plants, trees, things that remind you it's bigger than there's a whole wide world out there, and gives you some perspective on our daily life. But the other thing that comes to mind, and this is where, we thank our heroes, it's self-care for those that are caring for us, right? And our caregivers out there. ADAMH supported a program this year, first year funding, for a program called the Black Community Ambassador Support Program. And what it did, and especially during that time after the murder of George Floyd, where we were all questioning, are we doing equity right? Are we providing enough opportunities for equity? Are we taking an examination of our own organizations, of our households, of the way we live our lives, and are we doing it in an equitable way? And there were so many caregivers out there that were starting to feel anxiety about delivering the service in this space, having all these questions, wrestling with some of the challenges of daily life, and being asked, what does it feel like to be a person of color in America at this time? And should we protest? And, all of that support. And the Black Community Ambassador Support Program started holding these group sessions and learning from one another and being able to express that, getting some of that off of their chest, understanding that they're not alone in this struggle, and then partaking in the help resources and help seeking behaviors for our caregivers, because that's supremely important. And ADAMH wants to support care for the caregivers. So that's another thing I would say, more of that. I know the hospitals are doing that with our responders that are working 24 hours a day, 7 days a week, because we need them to be well when caring for other individuals that are not well. And it's a priority for ours. Director Bivens, I would love very much to be able, like you said, I think the resources on the Credible Mind website are really important and allow us to start thinking about self-care, what to do if we're not feeling quite right. And I know that there is a link to the Credible Minds website through the ADAMH website. And you can go there at adamhfranklin.org and receive the resources that you all have. And then, of course, information about our network.
Thank you for sharing that. One of the other things that I do is we're going to move to questions from the audience. I think we may have a couple. I don't think we have too many, but I want to make sure the audience has an opportunity. One of the other things I do is in the fall months, I changed the wattage of my light bulbs in my house to make it brighter because it's too cold to sit outside. And people think it's a hack, but it helps me. So the light, being in the light really helps me. Because again, I think, as we all have experienced, no matter, whether you felt an issue before COVID, if you didn't during this pandemic, you started feeling some anxiety, seeing all these things on the news. I limited my television time.
Yeah.
So when you live it, you work it, and then you go home and watch it all over again. I felt that I was feeding a continuum of feeding my system something that physically and mentally was not healthy for me. So, because I didn't like the way I was feeling, it was like this lull and this heaviness. And I said, I need to limit this because this is the contributor. Again, like all of you, to Erika's point, taking care of our caregivers. You have to step away sometimes to do that. So, parts. Go ahead, Eric. I'm sorry.
I was just going to say that was one of the things I did want to mention as well. We did the same thing early in the pandemic. We were glued to the television every day. Governor DeWine's announcements, CNN, the latest on the coronavirus. Should you wipe down your grocery bags? We were squarely in that space. And at one point, and I think it was after a significant loss, even in our family, I said, I can't take this right now. And we turned off the TV. And quite frankly, in the evenings, we didn't turn it back on. We felt it was healthier and better for us as a family to talk with one another and connect with each other to say, how are you feeling today? And it's today. It's not like for the next year. How are you feeling today in this moment, right? What went well for you today? And really tap into the moments we're grateful for, and then kind of to Robbie's point, what's the hope, right? What went well today? And, you think you're going to be able to do that tomorrow. You know what I mean? And that way we were each other's support system. And to that point, Joy, I mean, a lot of us love news, but we decided that we were going to pick the times that we wanted to consume as opposed to leaving the TV on where it consumed us 24 hours a day. The other thing we did was take a social media diet, quite frankly, because it was a lot. It's one thing to deal with your own challenges and anxieties and your own feelings, then to see others, and those of us that are really empathetic to others, it's like we're taking on our concerns, the concerns of our neighbors, the concerns of our friends and our family members, our community, and then the ones at work, and it was just a little too much. And we gave ourselves permission to flip it off, to turn it off, go on a diet, say, social media free Saturdays, social media free Sundays, and back away from the table, go for a walk, try a new recipe together, start a new project, plant a plant, anything like that. Write a short story, write a journal, write a gratitude journal, paint a picture. We've picked up all kinds of stuff. My one son has done like 17 puzzles, oh my gosh, it's incredible. But it was wonderful to get to know each other again, quite frankly. I have a 15-year-old son at home. And I didn't think I really knew how much he was feeling and what he was going through until this pandemic. And I've really found a way to reconnect as a parent.
Yeah, if I could just piggyback on that stuff, you're absolutely right. I think just stepping away from the news, the constant barrage, and the news is just doing what we expect them to do. We expect them to tell us the news. And I actually have a background where I worked for several years at a ABC affiliate down in Florida. And that's their goal, is to get eyeballs. And so they're going to present news in ways that frankly aren't necessarily healthy, especially from a mental health point of view, because they are in a business. They have to pay for their electricity bills just like everybody else does. And so I think choosing to step away from it is a fantastic thing. Cut back on it. You choose when you want, especially in the day and age we're living in, where it is right at our fingertips. That's both a blessing and a curse, because we have such quick access to it. We're so able to get to it immediately as things happen. At the same time, we become dependent on it in a way that is very unhealthy. And the same thing with social media. I remember seeing some of the responses when Facebook was down recently. There were people, they didn't know what to do with themselves. It's like their lives came to a standstill because Facebook was down. And it was just amazing to see some of these responses and how people were reacting to that. And even myself, I caught myself during the day. I realized, okay, I've got a habit of, at different times during the day, I'll pick up my phone and jump to Facebook just to see what's going on. And Facebook was down. And it hit me. It's like, oh my God, I'm just as bad as some of these other people I've been reading about. And it's very telling. And I love what you talk about, how you were able to connect with your family. That is exactly, I think that's the blessing we've had from this pandemic, is people have realized how important that personal connection is with others, even among our own households, of sitting down and talking to one another, engaging one another in ways that we haven't been doing for so long. And as a society, for so long, we've gotten away from that. We talk about on Facebook, I have so many friends, I have so many likes, but the reality is, are they really friends? The people who are right in front of us, those are the ones that we can help with their mental health. And those are the ones that are going to help us in our mental health, and to be at a place to where we have these help-seeking behaviors. And we've learned these because we've been desperate for it during the pandemic, of being cut off from people we've gotten desperate for it, but it's it is a good thing. And I hope that we find ways to keep people accessing this, even as we begin to, as restrictions are lifted, as we begin to go out again, so to speak, that we keep these help-seeking behaviors as much as possible.
Thank you for sharing that. I really appreciate you both being transparent and sharing some of the things and even affirming some of the things we know that we all endured during the pandemic and adapting to this newness, right? I want to make sure that our viewers know you can submit questions in the chat. If you have a question, please make sure you submit it in the chat. We only have a few more minutes left with our guest. I do have one question that someone sent me a text on my phone, so I'm going to read that question. Franklin County is so diverse, as you both know. Do you have resources for bilingual communities in Central Ohio? And how do they access that information?
What a great question, and such a timely one, because we want to make sure access is available to everyone, regardless of language ability. And during COVID, our partners at the state, the Ohio Mental Health and Addiction Services, and they've been champions throughout this entire pandemic and beyond, of course. But there was an allocation of COVID CARES dollars where we could really bolster the access supports during this time, as Robbie mentioned, to really make good on these help-seeking behaviors. And our crisis care line, 614-276-CARE or 614-276-2273, we offer language services on that line, translation services. So it's the same number for everyone to call. But if you call and English is not your native language or you speak a different language, translation services are available, and responders across our community that are sensitive to cultural needs are available to assist with connecting people to resources and not only the linkages, but keeping them and retaining them in those programs.
Yeah, Lost Community Services, we currently don't have them immediately available, but any of our services, we do have some community partners who have worked with us whenever we've had situations where communication was an issue. Again, most of ours, it comes from our immediate communication is on the scene when someone takes their life. And so we've been able to work in those times with people in the community who've been there for us and ongoing. We are working on getting some of our print materials into languages, translated into other languages. It kind of got put on hold a little bit because of the pandemic. One of the downsides to it, things kind of got pushed aside because of other concerns. But we are working on getting those translated and making those available.
And I should say, Deputy County Administrator Bivens, one of the goals for ADAMH over the next 5 years in our 5-year strategic plan, it is all about increasing equitable access to care. So we have targeted a suite of languages to make sure that all of our materials, digital, print, and translation services are available to not only our network partners, but of course, right there at the source at ADAMH. So please look forward to seeing us. We will continue to pursue more equitable materials and in different languages for all of our communities. But that shouldn't stop anyone from calling today.
Good. I'm going to ask you both if you would take a few moments as we close out. Any information that you want to share about your agency that you have not, or your entity, particularly, as it relates to mental health support services and that type of thing, whatever you feel like you would like for the residents of Franklin County to know. And then how do we access where you're at, Director Clark Jones? How do we access where you're at, Robbie Graham at Lost? Like, how do we access your services? Is there a 1-800 number? Do we walk in? Are you seeing people? Like, how does this work? So I'm going to start with you, Director.
Sure. Well, I would say, the one thing I would want everyone to know is you're not alone, and it's okay to not be okay or to not feel just right. And it's okay to call someone and say that. Our number, 614-276-CARE, that's our crisis line for anyone who just feels like something's not quite right or has a family member that needs some support. We encourage you to use that. And I think someone will put that in the chat for us today if it isn't already there. It's 614-276-2273. And then if it's a child that you're concerned about, please, our partners at Nationwide Children's Hospital, 614-722-1800 for anyone 17 and under that you know is experiencing a psychiatric emergency or crisis, or you just need some additional support. We want you to reach out to them. Always on. Those numbers are always on, 24 hours a day, 7 days a week, 365 days a year. And know that for connection to any services, including the Credible Minds service, that if you're just not sure, you want to do a self-assessment, and maybe you want to know if the feelings that you're having are normal, feel free to go to the ADAMH website at adamhfranklin.org, and that's ADAMH Franklin.org, and you can access all of those resources. That's why we're here. The taxpayers fund us to make sure that we have a behavioral health safety net, and we're always on. And we thank you, Director Bivens, for this opportunity to sit with our partners today, not only with you at the Board of Commissioners in the county, but also with LOS. They are the real heroes. They're the ones, all we do is push out the resources to make sure when people are in crisis, they can reach out. So I can kick it over to Robbie.
Thank you so much, Director Jones. Yeah, it's to contact us. Probably the best way to do that would be through our website, which is losscs.org, losscs.org. Also, our phone number is 614-530-8064. And yes, I'm having to glance down because I don't call the number. But yeah, that's probably the best way to do it. On our website, we've got some different resources available directly on our site. We have some wonderful articles by Dr. Alan Wolfelt, who is considered the leading expert in grief and grief studies, as well as being just a world-renowned counselor. He's got some great articles that you can reach through our website. We have our calendar of events, different things that we do for the survivors, as well as trainings that we do, prevention trainings. Counseling on access to lethal means, COM training that we do. These things are all are free to the community. Our services are always free to anyone who is suffering the loss of someone to suicide. They can easily they can call us, they can email us, they can reach us through our contact page on our website. They're also welcome to come into our office, and the address, we're here on Riverside Drive, right across from the Griggs Dam. And they can get our website, our address from our website, and come out and visit our office here. We usually have somebody here, at least one person's here every single day. And so we're all available to help in any way that we can, and even into referring people to other resources through ADAMH. We are big on our partners. You know, we can't do everything ourselves. We're big on partnering with others. Somebody else can do it, then we're all for it. But yeah, the website is going to be the best way to reach us.
Again, thank you both so much. And if you want more information, as they indicated, go to the resources that we were directed to, www.adamhfranklin.org and www.loss, C as in cat, S as in Sam.org. We also have the Credible Minds platform. If you are experiencing anxiety, depression, uncertainty, whether it's 4 a.m. in the morning or 4 p.m. in the afternoon, sitting in your car, laying in your bed, at the gym, you can go to www.franklincountyohio.credibleminded.com. You can even go to our Facebook page. I think we have some information on there for the Facebook page. But again, on behalf of the Franklin County Commissioners, Commissioner Kevin Boyce, Commissioner Erika Crawley, and Commissioner John O'Grady, I extend a heartwarm thank you to our partners, Director Clark Jones at ADAMH, who is doing a phenomenal job, who has weathered a phenomenal, heroic effort during this pandemic for all of us, as well as our friends, Mr. Robbie Graham at LOS, during this very uncertain time that we are still trying to figure our way out of. So thank you both so much.
It was my pleasure.
Thank you. We really
Thanks.
appreciate
Have a
your
good
support.
one. Thank you.